Hi, I'm Dr. Whit Church, and I'm here today to teach you about a radiographic tool we call the vertebral heart size, or the VHS. And this is a really important tool because assessing a patient's heart size radiographically can really help you decide whether the patient has significant cardiac disease or whether they're having significant progression of their cardiac disease. The other reason it's nice is because we're dealing with Chihuahuas, pugs, Great Danes. And we're supposed to be able to know whether they have a heart enlargement on a radiograph or not. And that's difficult. This makes it easier. So what we do with the vertebral heart size is on a lateral radiograph, we find the trachea. And we'll find the termination of the trachea we call the carina. And the ventral border of the carina is the base of the heart. And you're going to draw a line from there to the apex of the heart. That's our length measurement, because we're going to have to measure the length and the width, and the sum of that is the vertebral heart size. So then we're going to measure the width. After we've measured the length and the width, you start with the cranial border of the heart and draw a line to the caudal border of the heart. This is perpendicular to the length measurement, and usually the caudal margin is the ventral border of the vena cava or close to it. Then what we're going to do is find the fourth thoracic vertebrae. And we do that easily by identifying the really tall spinous process on the first thoracic vertebrae. It's an easy transition from cervical to thoracic vertebrae. So we'll count the first thoracic vertebrae at the spinous process, count 4 back. Then we'll draw that, or we'll follow that forward to the body of the fourth thoracic vertebrae. Start our line there, which will go backwards caudally. And we'll count how many vertebrae that is. In this case, it's 6 vertebrae, which is nice, but if it were 6.2, I would have written 6.2. We count it to the 10th vertebral body. Then we're going to measure the width. And we do the same thing. We find the fourth thoracic vertebrae, draw a line caudally, and count the vertebrae. And in this case, it's 4.5. So we'll add the length to the width. 6 plus 4.5 is 10.5. So what's normal? Well, normal is 8.5 to 10.5. If you're over 10.5, you need to consider additional diagnostics like echocardiography to confirm your suspicion of an enlarged heart. Or if they're having clinical signs, you should consider that they may be cardiac in origin. So that's the vertebral heart size. If you'd like more information on that, you can go to cardiaceducationgroup.org. Thanks.